left ventricle, B, left atrium, C, right atrium, D, right. Correct answer. Exchange of gases takes place in which of the following organ? A, lungs. Correct answer. The nurse is ordered to administer ampicillin capsule tid P.O. The nurse should give the medication in HELIP. A, 2 times a day by mouth. B, 3 times a day orally. Correct answer. Another name for knee chest position is A, genupectoral. Correct answer. A patient comes to the emergency department reporting a sore throat and earaches. The patient has a history of diverticulitis and emphysema with shortness of breath. Which route should the nurse use to obtain this patient and H039's temperature? A, oral, B, rectal, C, temporal. Correct answer. A patient comes to the emergency department and reports pain in the hip. Which patient statement best reflects chronic pain rather than acute pain? A, and quat, over-the-counter painkillers do not relieve the pain. Correct answer. Which nursing assessment indicates a period of exacerbation? A, and quat, patient status indicates an unexpected response, and quat. B, and quat, patient reports long-standing joint pain from rheumatoid arthritis, and quat. C, and quat, patient reports freedom from left shoulder pain after a cortisone injection for bursitis. D, and quat, patient was admitted because of a recurrence of clinical manifestations of lymphoma. Correct answer. A patient with moderate cognitive impairment who lives in an assisted living facility has been having more difficulty providing self-care over the past year. What intervention is most significant to ensure that the patient is receiving adequate nutrition? A, give the patient a liquid supplement between meals. B, weigh the patient weekly. Correct answer. A nurse plans to provide foot care for an older adult. What actions should the nurse include in this procedure? A, clean under nails with an orange wood stick while a foot is in the water. B, dry each foot thoroughly, especially between the toes. C, push the cuticles back gently with a washcloth. D, all of the above. Correct answer. Which skill should the nurse implement first when assessing a patient in H039's abdomen? A, auscultation. B, correct answer. A nurse is providing morning care to a hospitalized patient. Which statement by the nurse is most important before leaving the room after providing care? A, and quat, is your room temperature comfortable? And quat. B, and quat, your lunch will be served at around noon. And quat. C, and quat, would you like the door to your room closed? And quat. D, and quat, push your call bell if you need anything after I leave. And correct answer. A 12-year-old child is receiving intravenous patient-controlled analgesia postoperatively. The nurse teaches the child and parents about the trigger connected to the pump and how basal and bolus doses of the analgesic help relieve pain. Later, when the child is sleeping, the nurse observes one of the parents pushing the trigger to deliver a bolus dose of medication. What should the nurse do first? A, review with the parents that the child is still receiving medication even if not pushing the trigger. B, tell the parents to stop pushing the trigger when the child is sleeping. C, notify the primary health care provider of the parent and H039's behavior. D, increase the dosage of the basal dose. Correct answer. A nurse is admitting a patient to an acute care facility. The nurse should explain to the patient that the most important member of the health care team is which person? A, nurse practitioner. B, nurse manager. C, primary nurse. D, patient. Correct answer. A nurse is designing a teaching plan for a patient who speaks a different language. What is a reliable way for the nurse to facilitate patient understanding of the information? A, have a staff member who is from the same country act as an interpreter. B, provide a pamphlet with pictures to reinforce what is being taught. C, arrange a telephone translation service to be used during the correct answer. A nurse is assessing the physical status of several patients. Which patient problem should be the nurse and H039's greatest concern? A, difficulty breathing. B, tenting of skin. No. Correct answer. A nurse teaches a patient who is lactose intolerant about foods to avoid. Which food eliminated from the diet by the patient indicates an understanding about foods that contain lactose? A, Vegetable juice. B. Cream soup. C. Correct answer. A nurse is developing a teaching plan for adults who are overweight. What teaching method would be most effective to promote behavioral changes? A. Series of lectures. B. Online course. C. Group instruction. D. Colorful pamphlets. No. Correct answer. A patient is taking furosemide Lasix daily because of hypertension. The nurse should teach the patient to consume one or more of which foods daily. Select all that apply. A. 5. 1 cup of cooked spinach. B. 1 baked potato. C. 5 dried figs. D. All of the above. Correct answer. A nurse is assessing a patient with the diagnosis of dehydration. Which assessment should the nurse document on the patient and #039's record to support this diagnosis? A. Straw-colored urine. B. Bounding radial pulse. C. Low urine specific gravity. D. Tenting of skin. Correct answer. A primary health care provider orders total parenteral nutrition for a patient. What should the nurse do when administering this total parenteral nutrition to the patient? A. Remove the solution from the refrigerator 15 minutes before the infusion. B. Change the intravenous tubing set every 24 hours. C. Correct answer.